Hi, Kelly. My name's Matt. I'm a Harper nursing student. We're going to be doing a head-to-toe assessment today. Is that okay?
Mm-hmm.
Let me start with a few questions. Can you give me your full first and last name?
Kelly Rowan.
Good. Do you know what day of the week it is?
Monday.
Good. Do you know where you are?
The doctor's office.
That's fine. And do you know why you're here?
For the assessment.
Yeah, for the head-to-toe assessment. Good. So I can tell that you're alert and awake. You're oriented ×4. Your speech is even and clear, which is good. And, is this your normal skin color, would you say? Okay, good. Next, we would do the Snell and eye chart, which we don't have, but it would be on the wall. I'd have you stand 20 feet away, and then test each eye by covering the other eye. And then if you were able to read the line that was 20/30, that would mean that you can read at 30, or a normal person could read at 30 feet away what you could read at 20 feet away.
Okay.
Yes. So I would also take your vital signs.
Okay.
So respiratory rate, heart rate, blood pressure, and body temperature.
Okay.
I would also ask you for your height and weight, and I would calculate your BMI based on that. Your BMI would be your weight in kilograms divided by your height in meters squared.
Okay.
So now we can actually move on to the head-to-toe assessment. Looking at your head, I see it's normocephalic. Palpate for any protrusions, bumps, or depressions. Inspect for lesions or infestations. Don't see any. So you're good. Moving on to your face. Could you show me your teeth? Could you frown for me? Could you raise your eyebrows? Could you squint your face up? Alright, I see symmetrical from your eyebrows, your eyes, your labial folds, and the corners of your mouth. Could you also... I'm going to touch your face, sorry. Could you open your jaw for me? And close it? Alright, good. And now could you... and I'm going to palpate your sinuses, and just tell me if you feel any tenderness, okay?
Okay.
No tenderness?
No.
Alright, good. Next, we can move on to your eyes. So for this, I want you to just follow my pen light with your eyes, okay?
Okay.
Keep following it, and good. Alright, next I'm going to test your eyes for light. Okay. And your pupils are pearla, so pupils are equal, round, reactive to light and accommodation, which is good. Next, could you look up for me? I'm going to touch your lower eyelid. Alright, good. And next, just tell me if you feel any tenderness on your nose, okay? I don't see any lesions or any issues. Your nose looks symmetrical, septum intact. Could you close one of your nostrils and breathe through the other? And the other? Good. Thank you for that. Next, I'm going to inspect your ears, okay? Just tell me if you feel any tenderness.
No.
I see a piercing. That's okay. On this side as well. Any tenderness?
Nope.
Good. Alright, next, I'm going to, if you could open your mouth for me. Looking at your lips, mucosal, tongue. Can you lift your tongue? Good. And put it back down. Alright. See your tonsils. Could you give me a big ah?
Ah.
Good. Thank you. And could you stick your tongue out for me? Alright. Good. Thank you very much. Next we can move on to your neck. So I'm looking at your parotid and your salivary glands and your thyroid, and none of them are enlarged, which is good. Let's see. Next, if you could do some range of motion exercises for me, just look at the ceiling and put your chin to your chest and look to your left. Sure. And look to your right. And if you put your ear down and the other ear. Alright, good. And next I'm going to palpate your lymph nodes. So these are preauricular, postauricular, occipital, submental, submandibular, jugulodigastric, superficial cervical chain, deep cervical chain, posterior cervical, and then supraclavicular. Alright, no enlargement. And let's see, after that, I would listen, or actually first I'd palpate your carotid artery. Let's see, right here. Okay. And here. Okay. And I'm going to want to listen as well with the bell of my stethoscope. If you wouldn't mind, when I listen, I want you to just breathe in and exhale and then hold it, okay?
Okay.
Okay, so we do that now. All right, breathe again. Okay. I didn't hear any groovy, which is good. Okay, so next, I'll move on to your upper extremities.
Okay.
Let me just inspect them really quick. Do you have any lesions or cuts or bruises?
No.
Good. Okay. Let me see your nails. Good. Okay. Capillary root feels good. All right. Profile sign is good. If you could do some range of motion with me, just raise your arms up over your head, bend them down. Good. Put them back. Raise them up this way. Good. Just raise them like you're flexing. Good. And then twist your arms. Good. And now for your hands, just put them down, put them up, spread them. Good. And then also your fingers. If you could just put your fingers down and back up. All right. Good. Some strength exercises. Just squeeze my fingers. Okay. And then also, like you're curling, just curl. Good. Good. Oh, and let me check your radial pulses while we're here as well. Okay. That's good. Next, I'll move on to your chest. So I'm looking at your breathing. I see you're breathing regularly. No use of accessory muscles, which is good. And you're not barrel-chested, so I'm not worried about COPD. I'm going to listen to your breath sounds. Okay. So just deep breath. Deep breath. Deep breath. Deep breath. Okay. Back on. Deep breath. Okay. Deep breath. Deep breath. Deep breath. Good. If you wouldn't mind standing for the camera, we'll do your back. Okay. All right. Should start up here. All right. Deep breath. 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 Okay, go underneath here. Deep breath. 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 I know it's a lot of breaths. If you could raise your right arm a little bit for me. Thank you. One more deep breath. And then deep breath. Okay. Deep breath. All right, turn the other way. Thank you. And deep breath. Good. And deep breath. All right, good. And here are abnormal lung sounds, so that's good. Let's see. Right in rhythm was good as well. Oh, also, around your sternum and around your spine, I could hear bronchovesicular noises, and then through the rest of your fields, I heard vesicular noises. Bronchial noises would be if I listened to your throat. You can take a seat for me. Thank you. In fact, I'm going to have you lay down right now. Right, and we put the bed at a 30 to 45 degree angle. If you could turn your head to the right, good, and see any jugular venous distension. If you could look to the left, I don't see any there either. Okay, so I'm also going to want to listen to your heart. I'm going to listen at the apex. Yeah, thank you very much for that. Sorry. Thank you. Okay, I hear normal rate and rhythm and S1 and S2 noises. I'm going to listen at the aortic, and the pulmonic, and the tricuspid, and the mitral valves. Sorry. Okay. And I'm also going to listen with the bell of the stethoscope at all 4 areas. Okay. Now I'm hearing S3, S4 murmurs. So that's good. Let's see. Next, I'm going to want to assess your abdomen. If you wouldn't mind just moving down a little bit, it's easier if you're laying closer to flat for this. Okay. So, do you feel any tenderness or pain on your stomach? Okay, good. First, so inspecting it, skin color looks normal. As well with her upper extremities. Her skin color looks the same all throughout. Umbilicus looks normal, as well as for movements, I see respiratory movements, and I see a slight aortic pulsation. So I'm going to listen in all 4 quadrants. I'm also going to listen for brewing at the aorta, as well as the renal arteries. I hear none, which is good. Next, I'm going to palpate. So just tell me if you feel any tenderness, okay?
No tenderness.
Good. I want to make sure that I cover all of your abdomen so that I'm not missing anything. Okay, next I want to do some deep palpation, okay? So I'm going to be pressing it deeper. Still shouldn't hurt, though. Oh, also, I would also look at your stomach, and I see that it is slightly rounded, and for contour, I see that it's symmetrical. Or contour is that it's slightly rounded, and I see that your stomach is symmetrical, which is also good. So next, I move on to your lower extremities. Do you have any cuts or bruises or lesions?
On my feet.
On your feet, a couple of cuts?
Yes.
Okay. And any varicosities, varicose veins? Yes. I noticed a little spider veins on your legs, which is all right. Your legs are warm throughout. I don't notice any pretibial edema. I don't feel any either. Assess capillary refill. And it's about 2 seconds. I feel for your dorsal pedis pulses. They feel normal. 2+ for strength. next we would do some range of motion exercises, all right?
Okay.
So I just want you to pull your feet up and push them down, and then kind of put them together like that. Good. Flex them outwards. Good. With your left leg, just bend at the knee. Okay. And bring the leg up. Good. And bend it outwards. Good. Set it down. Same thing with your right leg. Good. And bend it outwards. Good. Put it down. Good. And next, we'll just do it with some resistance. So I just want you to pull your feet back again. Good. And push them outward. Good. And now if you could actually sit on the edge of the bed, and I want you to hold your leg out for 5 seconds, one at a time. Good. 1, 2, 3, 4, 5. You're good. Next, 1, 2, 3, 4, 5. You're good. Good. So that's testing your lower extremities. So next we test your neurologic function. For this, I want you to close your eyes, okay? And just say now when you feel the cotton ball, okay?
Okay. Now. No. 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 No.
All right, very good. And then I want you to tell me if I'm going to touch you with this either on the sharp side or the dull side. And I just want you to tell me which is which, okay?
Okay. Sharp. Sharp.
Mm-hmm.
Dull.
Yep, that's dull.
Soft.
Yep.
Soft. Sharp.
Yep, that was sharp.
Sharp.
Mm-hmm.
Dull. Sharp.
Mm-hmm.
Dull. Dull.
Mm-hmm.
Sharp.
Mm-hmm.
Dull. Sharp.
Oh, yeah.
Dull.
Mm-hmm.
Dull. Sharp.
Mm-hmm.
Sharp. Dull. Sharp.
Yeah.
Dull.
It can be a little tough. This isn't a proper instrument.
Dull. Sharp. Sharp. Dull. Dull. Dull.
Yep, very good. Yeah, we're getting them by the end. That's perfect. Okay, next, if I could just have you touch your thumb to each of your fingers and back. All right, good. If I could have you also bring the heel of your foot and put it on your knee and run it down your leg. Good. And with the other one. Good, very good. If I could have you stand up next, I'll have you just close your eyes, put your arms out in front of you, and hold that pose for 20 seconds. Okay, it's been 20 seconds. You're good. Negative for arm break test. Next, if I could have you just take a few steps that direction, and then walk back heel to toe. So heel to toe is usually one foot right in front of the other. Very good. Okay, you're good. Thank you. And next I'll do your reflexes. So if you'll sit down, I'll do your Babinski. All right. There's a little curling of the toes, which is normal. Some more curling. I know it can be ticklish. Next, I'm going to try to get your knee reflexes. Once again, I don't have a proper instrument for this, but okay, I see a little movement there. That's good. And this. All right, a little movement as well. Next, with your right arm, could you flex for me? All right, good. And just completely relax your arm now. Okay, I saw a little curling of your fingers, which is good. Okay. All right, I saw a little curling there as well. That's good. Next, if you could stand up for me once more.
Yes.
Face sideways towards the camera. I see that your spine is curved, convex at the thoracic, and convex or concave at the lumbar, which is normal. Forms that S shape. And if you could turn this way, thank you. I see that your spine is symmetrical, looking at your shoulders, your scapula, your hips, and it would be your gluteal folds, but we can't see this. And then also, if you wouldn't mind touching your toes. All right, good. I see that your arms go down the same length and that your spine forms that C shape, which is good. That's normal. Also, if you could do some range of motion with your spine, I want you to just keep your hips straight, but turn your body to the right and then to the left. Good. That's your head to toe assessment. Thank you, Kelly.